join us live. Okay, welcome everybody. How are we all diddling today? Are we keeping well? Get those comments in the chat box. My great pleasure to introduce Lindsay and Vicky again, who are leading the way in thinking through and supporting their teams with PPE. So the session today is really a follow-on session from our first webinar, which was kind of quite uncertain and unknown, and was at a time when everyone was trying to get their heads around using PPE. And what we were talking about recently, weren't we, Lizzie, was kind of now we've got a few months experience under our belts. How are things now? And is now a good time to come back together and just reflect on our experiences and start thinking for the future, because the new norm, well, we've got to create it, haven't we? We've got to create that model of what we want it to look like. So a couple of things about the session today. Lindsay and Vicky are going to deliver the session. I'll kind of manage the chat function. So I encourage you, as always, to put your comments and questions in the chat. And then if there's any kind of big ones, I'll interrupt the speakers, if that's okay, politely and appropriately with the questions. But so yeah. Oh, and the other thing, housekeeping, is if you are making comments in the chat box, can you make sure that the drop down box says to all panelists and attendees? Because if it just says all panelists, it'll just come to Lindsay and Vicky. So it needs to say and attendees, and then that way. So don't worry, lots of people have just been saying good morning. So there we go. Okay, so shall I hand over to you ladies then, and I'll put up the presentation.
Thank you.
Yeah, okay.
So, hi everyone. I'm not sure how many people joined us for the first session that we did probably a couple of months ago now, but I'm Lindsay Graham. I work at PPE and Independent Advocacy. We're primarily based in Cumbria and the north of England, and we provide advocacy alongside lots of other different projects. Vicky, do you want to introduce yourself?
Yes, thank you. Yeah, hi, I'm Vicky. I work for Cloverleaf Advocacy. I'm the Health and Safety Coordinator, and I've also managed advocacy projects over the last 20 years. So I do have advocacy insight as well as health and safety, which has become more prevalent recently.
Brilliant. And we've been really lucky, haven't we, Vicky, because we have been in a position where we've been able to support our advocates throughout COVID-19 to develop and upskill with regards to PPE, and that's why Kate has kind of invited us. So by no means do I profess to be an expert in PPE. I'm just wanting to share my knowledge, my experience, and skills that we've learned along the way, really. Would you say you're in a similar position, Vicky, or are you?
Absolutely, it's been an on-the-go experience since March, as you can imagine, with ever-changing guidance, etc. And I was new to sort of the health and safety arena about a year prior to this. So yeah, it did come as a shock, I have to say. And because as Cloverleaf, we have projects as far as North Yorkshire down to Lincolnshire, across to Greater Manchester. So we work with lots of different commissioners as well. So obviously things are different in different areas. So that's been a challenge as well.
Oh, well, we'll probably touch on that a little bit shortly, won't we? About the sort of challenges. Brilliant. Okay, so we've entitled our presentation "What, When, and How Now," because obviously things have changed quite a bit since the last time we did it. I'm not sure how many people were actually at our last session where we looked at the use of PPE, but things have definitely changed a lot. So we're going to look at giving you some updated information. So are we all right to move on, Kate?
Certainly.
Thank you very much. So just a bit of a recap, really. PPE is the provision of PPE is the responsibility of your employer, and that can mean physically giving you PPE, it can be reimbursing you for the PPE that you've purchased, or it can be ensuring that the setting that you are visiting has PPE available to you that is appropriate and of an appropriate standard and quality as well. So an example of that might be visiting a hospital where hospital trusts have specific policies and procedures in relation to their PPE, and they may provide advocates for PPE. And that's okay as long as your employers are reassured and confident that that PPE is appropriate for your use. PPE for advocates could include face masks and coverings that could be disposable, visors which can be reused, which used to be only said they could be disposable, but now they can be reused. Eye protection, that might be goggles or plastic glasses. Antibacterial hand sanitizer, antibacterial spray, disposable plastic bags for disposing of PPE safely, disposable plastic aprons and disposable gloves. Some people have allergies to latex, some people don't know they have allergies to latex, so preferably in the government guidance it does say use latex free wherever possible, and ensure that any of your PPE products are well labelled. So I know of some other organisations that have been sourcing their PPE from abroad, which is fine, but they can't actually, you know, the instructions and the information isn't actually in English, and you know, so you need to make sure that if you're providing PPE and you're being provided PPE, that you can read the label so it's really, really clear. You don't want to give somebody something they've got an allergy to. Okay, so there's a little bit of a what can it include, and I think Vicky, you'll probably agree with me that the guidance has shifted from being quite intense PPE, you know, you've got to wear all these things, and it's loosened off, and I think we're going to be exploring that hopefully on the next slide, Kate.
Yeah, I'd agree with you there, Lindsay.
Oh, we need to go back one, Kate.
Oh, here we go.
Sorry. Yeah. So Vicky, do you want to touch on some of the updates of the guidance? Do you want me to carry on?
That's fine. I can go through that, Lindsay. So essentially, it depends on the setting that you're in, whether you're delivering personal contact care, which as advocates, I wouldn't imagine any of you who are on the webinar are doing that. And it talks about sessional use. So around that, essentially, if you are in a care home, a sessional use would be in there, and it's basically the guidance has changed that generally all you would need is a fluid repellent mask. So no gloves, no aprons, no visors are needed there. Obviously, before you go in, then it's about doing risk assessments around that. But essentially, the sessional use can be, if you are visiting sort of 3 people in a care home, I would say that is a session. The guidance has changed now to say that you can move from setting to setting with the same PPE. And that really does depend on your own organisation as well, because remember, this is guidance. Organisations can offer something more than that. This is a minimum requirement. The other thing is that if you're travelling on public transport as well, that would be included within that session. And again, that's definitely something to check with your organisation regarding what they class as a session, because I really do think that's individual to your own organisation. Have you got anything to add there, Lindsay?
Yeah, so the guidance, it is updated regularly. It was last updated on the 23rd of July. The link, we have got a slide at the end with useful links. I don't know if Kate, you wanted to show the actual page that we utilise mainly. This is like the kind of the hub of the information where the guidance is updated regularly, and there you go, updated on the 23rd of July. And section 3 of this always tells you what are the updates of the guidance, so what are the main changes. So there's some things that aren't relevant to us around fluid repellent coveralls. It's highly unlikely that an advocate is going to go in a setting that needs full fluid repellent coveralls. It might not, it is highly unlikely, but it might not be a never event. So it's always worth sort of checking it and seeing what is relevant and what's not relevant for you. But somebody's just asked if we can post a link. It's in the slides, which will be shared afterwards. You'll be able to get that. And it also, the guidance, each time it's updated, it goes into a little bit more detail as well, which is really, really helpful. So it's more specific. So quite early on when we were doing the PPE guidance presentation last time, Vicky, it was very much up to our interpretation of the guidance. And whereas now we're being spoon-fed that little bit more, so it is more specific. So even for health and social care settings, if you were providing care, you know, it talks about labour wards and accident and emergency settings. So it's gone into a lot more detail now specifically. Are we okay just to head back to the presentation where I just check the what does the guidance say? Yeah, so the guidance is much clearer, and as Vicky talked on, we are going to touch on individual and organisational risk assessments in a little bit more detail through the session, because that is a prevalent part of the guidance. The government now is recognising a lot more that, I'm still on the other slide, Kate, don't worry. I'm still on the what does the guidance say. You're getting very clicky, finger happy here.
I keep losing the chat box, so I can't find it.
Oh, it's okay, you're forgiven. No, it's fine. So the guidance, you know, does talk a lot more about risk assessments, so we are going to touch on that and give you know, and I'm sure as organisations and advocates, you've all got, you know, used to risk assessing for lone working and going in different environments and things, and you'll be more used to risk assessing around COVID-19. But what we thought we'd do is we'd share some of the tools that we've been using, because I think they're working for us really, really well. So Vicky touched on the sessions and single-use sessions. We're going to cover that in a little bit more detail as well. And something that is really great now, which is a shame it wasn't promoted a lot sooner, was around recommendation of use masks for people themselves, face coverings for patients or people who are using services. You know, I think that's a great step that is now actually in the guidance. So if we could click on, we'll move on to risk assessment. So the government talks about individual, the government guidance talks about individual and organisational risk assessment. So this is around individual risk assessing, your interventions with individuals, so your initial meetings with people, or you might be supporting someone to a review, and that talks about, if you can, do your initial assessment remotely over the telephone and get all the information you need, then the government does recommend that you do that. If not, then it's a staged approach. It looks at maybe in a remote communal area, maybe a waiting room or a garden area, to get all your information for a risk assessment. And then it talks about, actually, if none of that is possible, then 2 meters distancing on entering the property. Obviously, when we with a lot of our advocacy, our referrals come from professionals. So they might come from social workers, consultants, healthcare professionals, and we can utilise the people who are making the referrals to feed into our risk assessments. So quite often, I don't know, Vicky, have you been finding you've been able to complete risk assessments before even visiting the property?
Absolutely. So what we formulated some time ago is what we call a pre-plan assessment. So that's essentially preparation for the visit, which ascertains where the appointment will take place, if the advocate's travelling on public transport, COVID symptoms for anybody who's attending the meeting, whether that's in a setting, a household, if an advocate has travelled or anybody in the household has travelled from abroad, needs to be assessed as well, just because obviously the travel corridors are changing. And then essentially we have an on-the-day assessment as well, because obviously once we've done the pre-plan assessment, now that can be anything up to 7 days ahead of the face-to-face meeting, we then have an on-the-day assessment, which comprises of 4 or 5 questions, which essentially are the COVID questions, because obviously that can change significantly. So we have got an example, so I don't know whether this is an appropriate point to go through those, if you want to bring up the plan.
Yeah, definitely. Yeah, no, that's great. That's great.
Okay, so I can quickly go through this. I think the key thing for us as an organisation, and it is a health and safety requirement under the Act that once you have assessed somewhere, if you get somewhere and you feel unsafe or you feel that the situation has changed, then what we say to all our team members throughout the organisation, of which we have about 180 to 200, is then they must leave. And it's as simple as that, really. And what we've done is installed that confidence in all of the teams that they can do that if they feel that the information is quite different. So this is the pre-plan assessment, and what we look at is why the visit should take place, essentially. Now, this is reviewed monthly, and at the beginning of lockdown, it was essentially about why can't virtual take place, because that was our default position, that everything would be virtual. Obviously, since lockdown easements, that has changed. So it's why should the visit take place? And then obviously you can see that I've embedded links in there. We've got a flow chart as to what to consider when people are looking at doing a face-to-face visit. So what I've tried to do here is make it simple for advocates to be able to just click on links rather than having to search for information. So then there's the question about whether the team member uses public transport, and then again that's about letting the setting know, because if it's a care home, obviously given the the difficulties that they've seen over the past few weeks, every setting now, every care home should have a visitor policy, and it's up to us to let them know that we'll be travelling on public transport, because essentially that might be against their visiting policy. So we need to check with them that is that okay. Then of course there's the next question is, has the team member returned from the UK? Now that is constantly changing, as we've seen from Spain this week, because again we need to check whether people are on corridors, whether they have to go into quarantine. So that's just us generally as advocates going into places. And you can see I've put accessed the date I've accessed these sites, and that's just for me really to make sure, because it's changing so much. And so often it's just to make sure that I'm on it. And like I say, I review these forms monthly unless there's a significant change, which there was last Thursday in some areas, and we'll come on to that later. So again, is the team member or anyone in the household shielding or extremely clinically vulnerable? Again, under the Health and Safety at Work Act, we do have a duty not just to our employees, but to their households, to the support bubbles, obviously to our clients, and to general other members of the public. So all these have to be considered in risk assessments in every visit that we do. Is the team member in a clinically vulnerable category? Because at the moment we've assessed, if you like, every team member as to whether they're shielding, whether they're in the moderate category, whether people in their household are in those categories, and we have phased approaches in terms of allowing people to go out and do visits, because we have that duty to people in their household as well. So that's why that question is on there. Again, has the team member or anyone in their household had symptoms? And that includes their support bubbles as well. If yes, they need to refer to the guidance, and again the manager may then have to reallocate the case. So as you can imagine, I'm ever so popular within our teams, because this is quite a significant risk assessment, but I do think it's taken into account every duty that we have under the Health and Safety at Work Act to make sure that everybody we are working with, because it is a RID or reportable disease and a public health disease as well, that we need to make sure that we are on top of it. So has the team member or anyone in their household had a test? And again, until they've had that back, then they can't do visits. So again, all the links are there. In addition to this, we do have an emergency action plan for if any of our team members do contract, and hopefully they don't, or if they contract through the place of work or through just generally going out, we have an emergency action plan in place that everybody has to follow. So you can see this closely links into that. And then we finally move on to the visit. Okay, because essentially, if the answer to any of those questions is yes, then the visit can't go ahead with that advocate. So eventually we move on to the visit. So what setting will it take place in? And we've put a drop-down box there that essentially includes care settings, hospitals, private households, shared accommodation, etc. So we need the visiting policy from settings apart from NHS settings, so if you're in care homes, again, it's that policy. We need that to make sure that the environment that our team member is going into has got controls in place, so that our team member is safe going in there.
Vicky, could I just ask a question? So when you were talking about testing, there's been a question in the chat, and somebody's asked, sorry, the name flashed up but then it went, so apologies. Somebody asked, does that mean that we couldn't go into a care home if we hadn't been tested? And my understanding of what your risk assessment is saying is that actually if we're waiting for a result of a test, then we wouldn't be going in the care home. If we've had a test because we've either been symptomatic, or we've been in contact with somebody who has been symptomatic, or we've been in, I don't know, a pub where they're recommending, and it's about waiting for the result, isn't it, before a member of staff would go into the care home, rather than actually us not having had a test, so we're not going into the care home.
Yeah, that is primarily, and I can understand why people might be confused on that, because on the 6th of July, obviously there was the guidance that came out that anybody going into care homes needed to be tested weekly. So that guidance has come out. That's looking to me like that will be devolved down to local authority areas, but there's no way on doing that. And obviously there's different, because we've got higher rates in Greater Manchester, Calderdale, Kirklees, there are pop-up test centres. So some team members, some advocates are doing that voluntarily. And again, we would need to know that, because if that's happened, we need to make sure that that test has come back negative before we would allow people to go out on visits. Could we just come back to that risk assessment, Kate? But yeah, so essentially that's if they have had that test. And again, it's about advising, because we're a medium-sized organisation, it's about making sure our own risk mitigation is in place, so that we have that, hold that information centrally. Because if somebody wins the lottery, such as me, and I don't come in tomorrow, then obviously somebody else needs to have that information, rather than just me holding that. So we do hold all this information on a private area of our SharePoint. So going back, can you meet the person in the outside area? That's always the default position. Can we do that outside? Obviously taking into account weather conditions and confidentiality. And a month ago, outside visits were absolutely brilliant because it was sunny, but obviously it's proving tricky now. Has the care setting made available a room as close to the setting entrance as possible? Because if you plan for an outside visit, but then obviously the weather is inclement, then you need a plan B in terms of, well, actually, where are you going in that care home? Because no longer can we wander around care homes like we used to. I can't imagine any care home wanting us to do that. And it's about reducing the footfall as much as possible through the care home, because obviously we don't want to take anything in. So going further down, it's about social distancing. So can the client maintain social distancing? Do they understand what social distancing is? If they don't, then I'm afraid that we wouldn't be able to do a face-to-face visit. Has the team member got the appropriate PPE? We've put nappy bags on there, sorry, because so our smaller disposables are nappy bags. So that's why that's on there. And if they haven't got the PPE and they haven't watched the training video and that they've signed for all that, then they can't do the visit. So they must, and that's why this is all on the pre-planned visit to allow time, because again, things change, and that's posted for them to sign that they have read that. And then the team member must confirm yes together, and must watch that video as well. And then I think that the end one on this is to consider that in actual fact, when we're talking about doing visits, we mustn't forget that other risks are involved. It's not just about COVID. We really must consider the other risks that we would have considered prior to that. So if you're doing a loan visit to a new client in a private household, that visit still must be done jointly, that people must use their alert app that we provide them with on their work mobiles. So it's just not forgetting that last bit as well. We can't just consider COVID. And we go into lots of settings pre-COVID we did something like 700 visits a week just into care homes, and then we had all the private household settings and everything on top of that. So it's taking into account every setting because we've put drop-down boxes on that. So that's the pre-plan assessment, and that must be approved by a line manager. So you can imagine I'm really popular. The other thing to think about in that as well is if you must have whoever symptoms, it's not just about the client. So there's a lot of work. And then we go to the on-the-day assessment, which is essentially, as I said before, pretty much just the COVID questions, because that could have changed quite significantly since you did the pre-plan, but everything else should stand the same. And then that's got to be recorded on the client's profile on our database system, so that if we do have a problem, if somebody, we can track and trace, and therefore we can inform the relevant authorities such as public health, RIDDOR, etc., because we would then have a duty to be able to make sure that we know who our advocates have seen, when, where, time, etc., and all that has to be recorded. So the systems behind this are in place to make sure that we can do that. So I hope that's helped. I know it's a bit laborious, I do understand, but hopefully it does keep everybody safe as we can.
Thanks, Vicky. Is now a good time if anybody's got any specific questions about the risk assessments? A couple of people have asked if we could share the template, Vicky. I don't know if that's, we'd need to check for that.
Yeah, our chief exec is on holiday, well deserved this week. I'll check with her when she returns next week. Yeah, I can't see that being a problem, but we'll check with Susie when she comes back next week.
Sure, but people can certainly make notes. And
you might want to remove your email address for ordering more PPE. Yes. Otherwise, I'll be encouraging my advocates to send their requests to you.
Just to let you know, on the top of this form, I have shortened it. There is there is a review box for every time this is reviewed and who we've consulted with within the organisation, because that is another duty under the Health and Safety Act that we must consult. So we have regular organisational briefings for people to come on. We've got one next week where we've got 90 people. And every time a phase is changed in terms of people being able to go out to visit, we hold those briefings internally so we can answer any questions that people might have and any concerns that they might have. But the top bit was very sort of cloverleaf led, so I took that off. But yeah, as you quite rightly say, Lindsay, there is some cloverleaf stuff in there which we'd have to remove if we shared that. Otherwise, I'll be ordering PPE for everyone.
Oh, brilliant. Okay. Those are our risk assessments follow a very similar theme. That is so comprehensive, Vicky. It's absolutely amazing, and you know, it must be reassuring for your staff to you know, I know you say, oh, I'm not very popular, but actually filling out that must, you know, really thinking about it in such detail must be really reassuring. So, you know, thank you for sharing those. I think they're excellent.
That's all right. To be fair, they do come back. It does make them feel safe. But I can imagine as an advocate, you just think, oh gosh, what a form to fill in.
I think that's a really pertinent point as well, really, because we can put all these risk assessments in place, we can provide all the PPE, but advocates have got to feel comfortable and confident and able to undertake the visit to maintain a level of face-to-face support. And I know quite recently we've heard of experiences where face-to-face visits have been so important. We've heard of experiences from advocates where they've received referrals from social workers who say the advocate needs to go and visit, but so when they've been contacted about risk assessment and visit planning, actually the social worker doesn't have the information because they're not actually visiting, because they've risk assessed that the visit is too high, the risk is too high to actually go and visit, but they want the advocate to go and visit. So it's, you know, it's about unpicking those things to help the advocates. And in some other experiences, I think I shared this previously, in some other experiences for say IMCA 39A DOLS assessments, where the best interest assessor has done a remote assessment but the advocate has done a face-to-face, have actually uncovered that they're completely, whereas the best interest assessment was going to recommend that the DoLS was put in place, the advocates realising that actually the person's got capacity, they've been under a DoLS previously, they shouldn't have been under, the restrictions are about protecting other people, not themselves, and, you know, completely the wrong framework. So, you know, I think through these types of discussions, I think it's really important to sort of support advocates to feel comfortable and confident to be going out and doing those face-to-face visits as much as possible, because, you know, they really do make a difference. So, and something like this is just brilliant, Vicky. Thank you for sharing. Kate, I feel like you're chomping at the bit to add something.
Brilliantly put, beautifully put. Keen to hear from people's experiences, because I think as we've seen the last 3 months, it's kind of changing, isn't it, week to week. So yeah, what are your experiences, guys, on risk assessments? If you've got a good risk assessment, is risk assessment like the holy grail in your organisation? And, you know, please, this isn't about shame and naming and shaming. It's just about getting a feel for where we're at as a sector. So yeah, but just kind of what were your thoughts and reflections? Is this something that you can see you implementing? Is this welcome, this idea? Is it scary? Kind of what's
just to let people know, Kate, they might be wondering what the green bits are. So every time I review a form, I highlight what I've changed, so people are not thinking, gosh, what she changed. So the last review was in yellow, this is in green, so the next one will be a different colour, and that's just a sort of handy tip if people are changing. Yeah, absolutely. So that advocates can see what has changed, and you'll see that the links have changed. They've changed from before the 31st, because obviously the isolation periods increased from 7 to 10 days, etc. So again, it's making sure those significant changes are always updated, which can be a bit laborious but important. Yeah.
Okay, so the feedback looks as if people are comfortable with risk assessments. It's so it's all happening, which is brilliant. Yeah,
fantastic. So just sort of summarising as well around the risk assessment in the government guidance, it talks about organisational risk assessments being important to look at local level and local context, and that's really quite relevant at the minute from last Thursday. Vicky, do you want to talk a little bit more about your experiences there?
Yes, so Friday I did think I had a day free of Zoom and I could catch up 6 weeks. But then, of course, local lockdowns were implemented across Greater Manchester, Calderdale and Kirklees. So obviously that meant a massive change, together with the fact that the isolation period had changed as well. That meant I had to go through our suite of documents. So it's the pre-plan, it's the on the day, it is the emergency action plan. We also have the organisational risk assessment. We also have these forms because we were doing social gatherings up to 6 outside in a park, so that had to change as well, because we do social inclusion visits, and obviously we do self-advocacy groups, and we wanted to make sure that they could begin from the 1st of August. So the local lockdown has affected a great area in terms of Greater Manchester, East Lancashire, Blackburn with Darwin, and some other areas, Rossendale, one beginning with H, sorry, which I can't remember now, and Kirklees and Calderdale. So what Hindburn, thank you, Lindsay.
All right.
So what we've done in all those areas now, we've stopped face-to-face visits. That is going to be reviewed on Thursday by the government. So again, we'll have to wait till Friday to find out what's happened, and then again, that's a chat between managers in terms of what we are going to be able to do and what we can't do. And then what we've said to all the advocates is stop face-to-face visits until the 10th of August, because despite it being reviewed on Thursday, we've then got to discuss that on Friday and review all these forms and then get these out to all advocates on the Monday. So it really is about thinking as well in terms of sort of implementing these systems, especially if you're working in medium to larger organisations, because it's about making sure advocates understand, and sometimes that's really hard when people have been on holiday and there's so many updates.
Definitely, and something that we've done as an organisation, I don't know if you've done this, Vicky, but our original enhanced coronavirus risk assessment was all about sort of, you know, when we were in the height of lockdown and restrictions were really heavy and tight, and as we've updated our template, we've actually now got a menu. So that one is, if we end up going back into lockdown at any point, we pull that one back.
Yes,
You know,
yeah.
sort of, that's the one we would go back to. So although we've been updating the templates, we've been using them so we've now got a menu of risk assessments depending on the level of restrictions that are imposed, which I think will save us redoing assessments in the long run, templates and things.
Absolutely. Sorry, my phone's ringing, so that's why I've just put myself on mute.
That's okay. Okay, Kate, can we have a look at what the next slide is, please? Okay, single sessions use of PPE. So this, the government guidance again has been clarified a little bit and relaxed. So Vicky touched on it earlier. A single session is about a period of time where a worker is undertaking duties in a specific setting or environment, in advocacy terms, we look at that as if, like, we're visiting, I don't know, a communal area of a mental health ward, or we're visiting a particular care home. And prior to the relaxation, it was very much you were visiting one person, you needed to change your PPE, you were visiting another person, you needed to change your PPE. But now it has relaxed so much that you could wear a face mask from one care home to the next care home, visiting different people, and that'll be an organisational decision alongside, in collaboration with your advocates, to look at actually, well, what does that mean for you? What does that look like in a local context? And Vicky and I, our organisations are quite aligned in our thinking, that we've communicated to our advocates that it's one care home, it's one session. So we wouldn't be wanting our advocates to go into everybody's bedrooms anymore, and walking around care homes, even if we were invited. But we would class it as one session. We would expect our advocates to swap their PPE afterwards. And alongside that, if during a single session the PPE was uncomfortable, it wasn't fitting properly around your nose, it was soiled, damp or damaged in any way, or you've been touching your face a lot, then you really need to be swapping your PPE. We need to change and discarding it safely. Some care homes will have appropriate bins, and hospitals will absolutely have appropriate bins to discard. If not, make sure you've got your bags with you that you can swap it, and you can doff it and then re-don your next PPE. Okay, Vicky, did you have anything to add to that?
Just that what I'm looking to buy for all our advocates is keyring sanitisers, so that they can transfer hand sanitizer, because one of the good things about PPE, I would say, to do is make sure that you have a good relationship with your supplier, because obviously you've got to get your cost assessments up to date, etc.
Yeah.
Ties on a keyring so they can transfer, but if anybody is buying clear keyrings, they must have a label on that with the sanitizer that they're putting in. That's a legal requirement, so that's just useful just in case of going into care homes, because originally what I'd said is, in terms of not taking in bags, etc., taking in limited equipment, and then bring it out. And what's come out of our organisational briefings is that they haven't got enough pockets, or the trousers are down their ankles because they're carrying that many things in their pockets. So I just thought that would be easier. So just in terms of that, that's sort of a handy hint, really.
Yeah, I've seen some people use lanyards, and they have they've attached an anti-bac gel to a lanyard. Like you used to get the little telephone pouches.
Yeah, I've asked people to take their lanyards off and just use their bags in their pocket, just again because it can be another transmission. But again, organisation, sort of individual to the organisation, isn't it? But it's a tricky one, isn't it? It's because obviously we want them to go in with as least equipment, but obviously advocates need that in terms of note taking So we've done note-taking guidance as well, Lindsay, as well, and provided information on that.
And phones for lone working. We ask our advocates to wear clothes with pockets, and put the car key in one pocket and the phone in another, and things.
And have you had feedback that it's just too much to carry?
No, actually, it's been okay. We've it's not been bad. We've not had negative feedback in relation to that. Note taking has always been a bit of a challenge, but what we've encouraged people to do is type into the phone. If they're using the phone for loan working as well, then just to type a note in the phone and be mindful of confidentiality and so forth. And
I think I probably didn't help our advocates in terms of the size of the bottles of the sanitizer, really. I perhaps didn't think that one through, to be fair.
Okay, brilliant. So, hot off the press on Friday, Public Health England published an illustrated guide to PPE use in health and social care settings, and it does go into a little bit more detail in later pages, but in the first couple of pages it talks about 5 different scenarios, really clear language and clear pictures as well. And we were looking at this earlier, weren't we, Vicky? And we were talking about number 3. Number 3 is the one that we are mainly using or going to use for our advocates. So number 3 is, it might be a bit blurry, so apologies, but when you are within 2 meters of an individual being cared for whatever reason, but you're not touching them, then type 2 surgical mask is appropriate, and that's what they're advising. So they're not advising that you wear gloves. They're advising that you increase your hand washing and use hand sanitizer, and that extends to your lower arms as well if they're bare, which in our PPE procedure we ask for advocates to have bare lower arms. And it says that no apron and gloves are required, and that is a definite shift over the last couple of months regards to the amount of PPE that advocates need to carry around with them, but advocates still need to be prepared. So there are other scenarios in this booklet, and we've got the link again at the end of the presentation. We've popped the link in so you can take it straight to, but it's only 8 pages long, so it's probably a nice little booklet to send out to your advocates, and for advocates to use, because it helps you really clearly think about what PPE to wear. But the risk assessment mainly talks about the risk assessment will result in, are you doing a visit or are you not doing a visit, and what PPE you need, and this guidance will support that. So primarily for most visits now we're providing masks. We do provide other things as well, so if there was a risk of, I don't know, say spitting, then we would expect advocates to wear their visors alongside the face mask. We wouldn't expect advocates not to wear the visors for that. And that's when they would need the other types of PPE, like their anti-bac spray and disposable cloths and carrier bags as well. So number 4, when you're caring for a person who is shielding, that's about providing care. So some of them are about providing care in here, and some are about, number 5, when you're in the workplace and 2 meters or more away from people you are caring for or supporting. That might even be for in general office environments. I don't know if many advocates are going back into the offices or currently, but they might need to wear masks or face coverings. So I think what's really important in our sort of oh no, that's the final slide. I'm not going to go for that one then. We'll move on to the next one, if that's all right, Kate. I'm not sure what we're like for time. Oh, it's 11:45. That's gone really fast. Do you think that's gone fast, Vicky?
It has most definitely.
There's something that we're doing as an organisation, and I'm aware Vicky's also doing this. We're actually monitoring our PPE supplies and our PPE usage, And part of that is to look at like what stock we've got. So on Vicky's risk assessment, it says email this address if you need some more PPE. Well, then Vicky's got to be planning and organising and making sure that she's got that PPE that she can send out to the advocates. So by monitoring your supplies and having good relationships with your supply chains, that it will help you plan for different eventualities. So it might be local lockdowns, it might be periods of increased use, it might be periods where you don't need to use any at all if you're not doing face-to-face visits, if the risks are too high, and it helps with contingency planning as well. There is something around cost as well, because prior to COVID-19, we wouldn't have spent a lot of money on PPE as advocacy organisations, but obviously that is changing now depending on the size of your organisation. So by monitoring usage, you can plan for all eventualities.
I think that, Lynn. Oh, sorry, Lindsay.
No, go on.
I'm just thinking in all of that as well. Gloves have doubled in price since the beginning of lockdown, just because of supply and demand. And one thing to consider is the relationship with China at the moment, with the UK. Obviously there's some issues there, so it is one thing to think about when you're buying your stock, is actually how much you're going to buy, and thinking about that. And obviously we've got Brexit as well coming, so these are the things to think about when you're buying stock and how much you might need.
Definitely. There's also some there are some charitable organisations and funding streams that you can access to get PPE. I know we've accessed a number of different organisations. We've been donated PPE as well through some of our local rural community, from some farmers, and there are different funding streams, so it is worth looking out for some of those local. I know a local garden centre, large garden centre chain, very kindly donated us some funds to enable us to purchase some additional PPE. So it's worth just having a little look around and seeing what else you could, where else you can access PPE from, which is really helpful.
Has anybody had any success in getting CCGs to pay? Because I think government released some money, didn't they? I know it's been hard to get hold of. Wondering whether that's a route.
We've not had any as an organisation. We've not had any from our CCGs. We have worked alongside carers who are managing direct payments, who have had an increase to enable them to pay for more PPE, which has been very positive and very welcomed. We've had some PPE provided by local authority commissioners in some areas where we work, and we've also built relationships with local sort of COVID-19 emergency response forums. There's often a PPE working group that's looking at sort of the third sector and the voluntary sector and the public sector, pulling things together as well. So it's about sort of like just looking at what's out there, and that's part of your contingency planning as well.
Great.
Yeah, I don't know if anybody else has had any experiences.
No, we haven't. It seems to have gone okay so far, but like you say, I think going into winter as well, autumn and winter, might put some pressure on the system. So again, it just comes back to that relationship with suppliers and making sure as well, because obviously there's been some recalls on masks and gloves from what people have bought on the internet. So I think that's one thing to consider really, in terms of best value and price versus a good relationship, because you need to make sure that obviously, we're getting quality supplies, absolutely, and that it's safe. So sorry, Lindsay.
Oh no, sorry Vicky, I kind of interrupted them, but there's some suppliers as well that limit the amount you're able to purchase and the types. There's some suppliers where you have to have a CQC registration to purchase some types of PPE as well. I don't know if you've come across that, Vicky.
No, just because I think I've got the one supplier, which luckily was verbally recommended to me, and I've kept with that. And that is simply, again, just because then I've got his health and safety policy. I've got all the documentation to know that everything is 100% in terms of safety for the advocates who are using it. And I've got all the specifications for the COSH assessments and things like that. So I've kept with that. And whilst he's not the least expensive, I'm secure in the knowledge that I've done everything I can, and he's got everything. So, and again, he's providing the labels for me for the hand sanitizers. So again, it's those little things, isn't it, that make it worthwhile as well. Otherwise, I'd have to print all of those off, etc. And he will distribute. I don't know whether other people who are listening, it's about when everybody's home based, it's about getting PPE. So it's the logistics of the whole thing for getting PPE to 200 people at different times. It can be quite time consuming and costly and difficult. So yeah, we've just come up with a system where he will deliver that as well. So
that's brilliant. We have advocates collect as well. They'll collect a PPE package. We work alongside another organisation that provides a PPE welfare pack for their advocates, which includes a refresher of how to use PPE every time they do a face-to-face visit, which is really great. I noticed that somebody said, could anybody share where they get their PPE from? There's a national supplier that a lot of care homes and sort of nursery settings use, called Gompels. Don't know if you've come across Gompels. They've got a really great website where they provide PPE. Again, that is limited. Gompels, Gomples, Gompels. Yeah, interesting name. And they depending on how much you purchase, depends on how much you can spend on specific PPE, and they've got some really great ratings and questions and answers on each specific. I don't know if you ever used Gompels, Vicky.
No. I was going to say as well, things the Carers Alliance as well, I think, have suppliers that might be local to people's local areas on their website. So it's good, because again, if you can get somebody local, because we're a Yorkshire-based company, for us, I wanted to find somebody in Yorkshire because I wanted to keep that expenditure local, and obviously because they have supply chains, it's keeping everybody in that area in work as well, because that's kind of our social policy as well. Sorry, I've gone into one now, went on a bit of a soapbox.
No, you're on social value now. That's a whole new webinar, that is. Hey, get booked on.
But yeah, it's making sure all that. But yeah, those are the places to look for local suppliers, definitely, and discounts as well.
Yeah, brilliant. Thank you. So our final slide. Oh, it's not our final slide, but it is the kind of final one. The finale is that PPE is not effective on its own. It's all very well us wearing PPE and being comfortable and confident, but we've got to remember we've got to increase our hand washing, and there's got to be increased cleaning in the environment. We've got to maintain social distancing, and also we've got to be self-aware. I don't want to sound patronising or anything like this, so I'm going to pull this right back to me. I'm often if I'm unwell, I think, am I really unwell? And I don't stop doing anything. But actually now I think, really, if I was unwell, I would need to go and get tested. I would really need to be responsible and think about where I've been and things. So I think, all of that together with the PPE is great in our battle against COVID-19.
I'm just thinking there, Lindsay, I don't know about other organisations, but we signed up to the portal, the government portal, where you've given an employer number so that you can get tests direct to people if they've got symptoms, or you can book them in their drive-through appointment. Again, that depends on local lockdowns, because essentially local lockdown areas have pop-ups in every area. One day it's there, the next it's gone, and people can go to those. But if people are struggling to get tests, your employer can sign on to that portal and get a number and book a test in for you. So that might help in terms of speed.
Yeah. Would it be worth us adding that link onto the place where we send out? I know we've developed a testing procedure for our staff as well with regards to what they need to do if they're getting tested, and what they can expect.
Yeah,
so it might be that we can share something like that if people are interested.
I'll send that link, Kate, and then if you've got a list of everybody who's on, you can send that.
Is that it?
Brilliant. Does anybody have any final comments or questions?
Or have we lost everybody? That's the problem with these things.
Yeah.
We never know, do we?
No, people are still here. We've lost.
That's good.
Right, I'll put that link. That looks as if it's the.
That's the one.
That's the one. Portal service. Yeah.
Oh, look at this efficiency.
I'm impressed, Kate.
Incredible.
And under pressure as well, Kate. That's amazing.
Do that again.
Under pressure as well. That's amazing.
Pressure. So guys, any reflections, questions, comments? That's great. Yeah, we'll definitely circulate the slides, and which will have the links in, but we need to check about sharing the risk assessment itself.
Yeah.
So we'll send the slides out, Sarah, to everybody who came today. Well, everyone who registered actually. Yeah, because it's, I was thinking as well culturally how, just on your last point, Lindsay, in the past people would soldier on, wouldn't we, with coughs and sneezes, and you get on the train, everyone would be sneezing and kind of accepted, wasn't it? Whereas now we'll see a complete reversal of that now. Was there a final slide? Yes, it was. It was
just useful. It was useful links. So it's got a link to the illustrated guide.
Yeah.
The donning and doffing procedures as well, because it's always useful to just refresh. And then the main point to the main hub of information around PPE.
Great. Okay. Well, I'm not seeing many kind of specific questions coming on, but lots of thanks to speakers. So I'll echo that, Lindsay, Vicky. Thank you so much for giving us the time and sharing your experience. Jay, you've been 20 weeks of shielding. Gosh, hope this month goes all right for you and for anyone else that's been shielding. It's, I'm sure, anxious times. But yeah, all right then. Shall we say bye? And until next time, take care.
Take care, everyone.
Brilliant. Thank you.
Bye.
See you later. Bye.